Hi there, fellow heart enthusiasts. Ready for another deep dive?
Always ready to explore the wonders of the human body.
Today we're focusing on something pretty vital, wouldn't you say? The heart.
Absolutely. It's the engine that keeps us running.
We've got this excerpt from a medical textbook, all about the heart, anatomy and all that.
A classic.
Yeah.
Perfect for understanding how this incredible organ works.
So it's like a guided tour of our own pumping station.
It's more than just a pump, though. The heart's ability to adapt, to keep everything balanced even when things get tough. It's remarkable.
I like that. It's like it has its own intelligence almost.
In a way, it does.
Okay, so before we get too deep into that, maybe we should start with the basics. Systole, diastole, those words always come up when we talk about the heart.
Right. They're the two main phases of the cardiac cycle.
But what do they actually mean? I mean, I hear those terms, but I'm not sure I could really explain them.
Well, imagine your heart is like a balloon. Okay,
a balloon.
Systole is when the balloon squeezes, pushing the air out. That's your heart contracting, sending blood out to the body and to the lungs. Then comes diastole, when the balloon relaxes and refills with air. That's your heart relaxing and filling back up with blood.
So that's like a constant cycle of squeeze and release.
Exactly. And that's what keeps everything circulating.
So it's never ending, like a game of balloon volleyball in our chests.
That's one way to think about it.
But this balloon needs the right amount of air to work, right? What about preload and afterload? I always mix those up.
Those are important concepts too. Think of preload as how much air you blow into the balloon before letting go. The more air you put in, the more forceful that squeeze.
Right. More air, bigger squeeze. Makes sense.
So preload is like how much blood your heart fills with before each contraction. The more it fills up, the stronger that contraction. More filling, more power.
Got it. So preload is about the filling power. What about afterload then?
Okay, afterload is the resistance the air encounters as it rushes out of the balloon.
Resistance? Like what?
Think of it as like a narrow opening or a strong wind pushing back against the air. In your heart, afterload is the pressure that your heart has to work against to push the blood out to the body.
Oh, okay. So like if the balloon opening is really tiny, it's harder to force the air out.
Exactly.
So the heart is always adjusting how much it fills and how hard it squeezes based on those factors. It's a balancing act.
A very intricate balancing act, yes. And what's fascinating is that the left side of your heart, the one pumping blood to your whole body, it actually faces higher pressure than the right side. Wait, hold on. Higher pressure on the left side. Why is that?
Well, think about it. The left side has to push blood through your entire circulatory system, while the right side just sends it to the nearby lungs. It's like sending a package across town versus sending it across the country.
Longer trip, more obstacles.
Exactly. That longer journey means more resistance for the left side to overcome.
Wow, so my heart is like a cross-country delivery service. I never thought about it like that.
It is a remarkable delivery system. But how does it know when to squeeze and release? Are there instructions somewhere?
That's where things get really cool.
Yeah.
Your heart has its own built-in electrical system, like a conductor leading an orchestra. It ensures that every beat happens in perfect rhythm.
So there are actual electrical signals in there.
Absolutely.
That seems pretty high-tech for an organ.
It is. And it all starts with the SA node, your heart's natural pacemaker. It's like the conductor tapping their baton. To start the music, this node initiates each heartbeat.
Okay, so the SA node sets the tempo. What happens next?
The signal travels to the AV node, which creates a tiny pause, like a musical rest. This ensures that the atria, the upper chambers of your heart, contract and fill the ventricles before they contract and pump blood out.
Okay, so it's like a dance move. The atria fill the ventricles, then the ventricles take over and send the blood on its way.
Precisely. And then the electrical signal goes down a pathway called the bundle of His, which splits into the bundle branches, and then the Purkinje fibers, carrying that signal to all parts of the ventricles.
So it's like a relay race, making sure the whole heart contracts in the right way. Smooth and coordinated.
A perfectly synchronized wave.
What happens if the system gets messed up?
That's when you can see things like arrhythmias, problems with heart rhythm.
That sounds serious.
It can be, yes, but even on a smaller scale, things are incredibly complex. We've been talking about the heart as a whole, but what about the individual cells?
Oh, you're going even deeper.
Well, your heart has two main types of cells. First, you have the cardiac myocytes. They're the real workhorses, the ones responsible for contraction.
So like each tiny cell has its own little electrical system?
In a way, yes. Their activity is controlled by something called an action potential, an electrical signal that triggers that whole process. And these action potentials involve sodium, potassium, calcium, All sorts of ions doing a very carefully choreographed electrical dance that leads to the muscle contraction.
So it's like a microscopic symphony
Yeah,
happening inside each cell.
that's a great way to put it. And then you have the other type of cell, the pacemaker cells.
Ah, yes. The conductors of this microscopic symphony.
Exactly. They're the ones setting the heart's overall rhythm. They have their own action potential, too. A bit simpler, but just as important.
So each little pacemaker cell is like a mini conductor, keeping the beat for the entire heart. That's wild.
And what's even more interesting is that different pacemakers, like the SA node and the AV node, they have their own intrinsic rates. They naturally fire at different speeds, which helps to fine-tune the heart's rhythm.
It's like a whole team of conductors, each with their own style, but they all work together to create this beautiful symphony.
A very intricate and essential symphony.
So everything we've talked about so far is like the healthy heart, right? How it's supposed to work. But what happens when things go wrong?
Well, that's when we could see conditions like heart failure emerge.
Heart failure, huh? That sounds pretty serious.
It is a serious condition, yes, but it doesn't mean your heart just stops working. It's more like your heart is struggling to keep up with the demands of your body.
Oh, okay. So more like it's sputtering instead of running smoothly. But why would it start struggling like that?
Well, there are a few reasons. One of the most common is high blood pressure, hypertension.
Right, hypertension.
Over time, that constant pressure on your arteries, you can actually make your heart muscle thicken, which makes it harder for your heart to relax and fill with blood.
So it's like the heart is working out too much, getting all bulky, but in a bad way.
You could say that. And a thicker heart isn't always a stronger heart, unfortunately. It can actually become less efficient at pumping blood.
Huh. That's weird. You'd think thicker muscle would be better.
It's like trying to fill a small, stiff container. Even if you have a powerful pump, you can't get much fluid in there if the container won't expand.
That's a good way to put it. So the heart is working harder, but it can't pump as much blood because it's not filling properly.
Right.
Okay, that makes sense. But you said there are other reasons for heart failure. What else can cause it?
Well, another common cause is coronary artery disease. That's when the arteries that supply blood to your heart muscle get narrowed or blocked. And that can starve the heart of oxygen and nutrients, leading to damage and weakening of the heart muscle.
So in that case, the pump itself is getting damaged.
Yeah, and that can really reduce its ability to function properly. There are other things that can cause it too, like certain viral infections that attack the heart muscle, or problems with the heart valves.
Wait, the valves can cause problems. I thought those were just like passive flaps that open and close.
They are, but they play a crucial role in making sure the blood flows in the right direction. Think of them as one-way doors in your heart.
Okay, one-way doors.
If a door is leaky or doesn't open all the way, it can really mess up the flow of traffic.
So what kind of problems can happen with the valves?
Well, one common one is called aortic stenosis. That's when the aortic valve, the one that controls blood flow from the left ventricle to the aorta, it gets narrowed.
Okay.
And so the heart has to work much harder to push blood through that smaller opening. Puts a lot of strain on the left ventricle.
Like trying to squeeze a watermelon through a straw?
Something like that.
No wonder that's a problem. What else?
Another one is aortic regurgitation. That's when the aortic valve doesn't close tightly. So blood leaks back into the left ventricle after it's been pumped out.
So it's like a leaky faucet, wasting blood and making the heart work overtime.
Exactly. And the other valves can have issues too, like mitral valve prolapse, where the leaflets of the mitral valve, the one between the left atrium and left ventricle, they don't close properly, so you get that backflow again.
It sounds like any kind of valve problem can really throw things off. But how do doctors even figure out what's going on with all these different possibilities?
Well, they have a few tools. One of the most common is an echocardiogram. It uses sound waves to create a moving picture of your heart.
So it's like an ultrasound for your heart.
Exactly. And it lets doctors see the size and shape of the chambers, how well the valves are working, how efficiently your heart is pumping blood.
So they can see how everything is moving. That's pretty cool. What else do they use?
Another important one is the electrocardiogram, the ECG. It measures the electrical activity of your heart.
Oh, right. The action potentials we were talking about.
Exactly. The ECG picks up those electrical signals, so doctors can see if there are any abnormalities in your heart rhythm.
So they can see the electrical symphony.
In a way, yes.
What about blood tests? Can those tell us anything about the heart?
Yes. Blood tests can measure levels of certain substances that indicate heart damage, like troponin, or markers of stress on the heart, like BNP.
Okay, so it's like a combination of imaging, electrical stuff, and blood tests.
Right. They use all of that to try to piece together what's going on.
It's like a detective story.
It can be, yes.
But what about heart failure specifically? How do they diagnose that?
Well, they look at your symptoms, your medical history, findings from a physical exam, and of course the results of those tests we talked about.
So it's not just one test, it's like a whole bunch of clues they have to put together.
Exactly.
Okay. But let's go back to those symptoms for a minute. We talked about how valve problems, coronary artery disease, can cause heart failure. But what does it actually feel like? What kind of symptoms would someone have?
Well, that's a great question. And it's important to recognize the signs because early detection is key.
Right.
The symptoms can be subtle at first, and they can vary depending on which side of the heart is most affected.
Oh, so it's not just one set of symptoms. It depends on which side is having trouble.
Exactly. Remember how we talked about the left side pumping blood to the body and the right side to the lungs?
Right.
Well, if the left side is failing, blood can back up into the lungs, and that can cause shortness of breath, especially when lying down or exerting yourself.
So it's like your lungs are getting congested with blood.
Yes, and that makes it hard to breathe. You might also hear wheezing or crackling sounds when you breathe. Fluid buildup in the lungs.
That sounds scary. What about right-sided heart failure?
If the right side is failing, blood backs up into the veins, the ones returning blood to the heart, causes swelling in the legs, ankles, feet.
So it's like the rest of the body is getting congested instead of the lungs.
Yes. And you might see swelling in the abdomen too.
Yeah.
And the veins in your neck might stick out more because of the increased pressure.
Okay, so it's important to pay attention to any swelling, shortness of breath, especially if it gets worse over time.
Right. Those could be signs that something's not right.
But are there other things people should watch out for? Risk factors that make them more likely to have heart problems?
Yes, definitely. There are a number of risk factors. Some you can control, some you can't.
Okay, so like what? What are some of the things people can control?
Well, one of the biggest is smoking. Really damages your blood vessels, increases your risk of heart attack and stroke.
Yeah, that's a big one. But at least it's something you can choose to stop.
Right. Another is high blood pressure. But there are things you can do to lower it, like eating a healthy diet, exercising regularly, managing stress.
So lifestyle changes can make a difference.
Absolutely. High cholesterol is another one you can often manage with lifestyle changes and medication.
So healthy choices.
Exactly. And don't forget about physical inactivity. Exercise strengthens your heart, improves your overall cardiovascular health.
Gotta get moving.
Even a little bit helps.
What about the things you can't control?
Unfortunately, there are some things you can't change. Your age, gender, family history. As you get older, your risk of heart disease naturally increases.
Right. Makes sense.
Men are also generally at higher risk than women, although that gap narrows after menopause. And if you have a family history of heart disease, your risk is higher too.
So even if you do everything right, there's still a chance you could have problems.
That's true. But even if you have those risk factors, it doesn't mean you're destined to develop heart disease. By focusing on the things you can control, you can still reduce your risk.
So it's not all doom and gloom.
Not at all.
What about congenital heart defects? Are those related to any of this?
Congenital heart defects are a different category. Those are problems with the heart's structure that are present at birth.
So you're born with them.
Right. And they're usually caused by errors in the heart's development during pregnancy.
Interesting. So not something you develop over time.
Right. And we don't always know why they occur. But some things can increase the risk. Certain genetic conditions, maternal infections during pregnancy, exposure to certain medications or substances during pregnancy.
It sounds like there's still a lot we're learning about those, but you mentioned earlier how amazing the heart is at adapting. Can you give us an example of how the heart can actually change in response to, challenges?
Sure. One fascinating example is a condition called Eisenmenger syndrome. It's a complex condition that can happen in people with certain types of congenital heart defects, like a ventricular septal defect, which is basically a hole between the two ventricles of the heart.
So the two sides aren't completely separated.
Right. And because the left side normally has higher pressure, blood flows from the left ventricle to the right ventricle through that hole. Okay. And this shunting of blood, it can overwork the right side of the heart, leading to changes in the pulmonary arteries, the blood vessels going to the lungs.
So the right side is getting a workout it wasn't meant for.
Exactly. And here's where the adaptation comes in. over time, the increased blood flow and pressure in those pulmonary arteries, it can cause them to thicken and narrow, a condition called pulmonary hypertension.
So the blood vessels are like reacting to all that extra work.
Yes. But this adaptation can backfire, so to speak. As the pressure in those pulmonary arteries goes up, it can eventually exceed the pressure in the left ventricle.
Wait, so the pressure flips?
Yes. And because of that, the blood flow through the hole can actually reverse. So now blood is flowing from the right ventricle to the left ventricle.
Wow, that's wild. The heart is basically rewiring its plumbing to deal with all that pressure.
It's a really remarkable example of how adaptable the heart is, how much plasticity it has. But unfortunately, this particular change is maladaptive because it means deoxygenated blood is mixing with oxygenated blood. So the overall oxygen level in the blood pumped out to the body decreases.
So the heart is trying to compensate, but it ends up causing a new problem. That's fascinating and kind of sad, too.
It is. It really highlights the delicate balance that exists within the cardiovascular system and just how complex the heart really is.
Yeah, we've covered so much already. From the basic mechanics to heart failure, congenital defects, it's amazing how much is going on in this one organ.
It's a powerhouse.
And I feel like we've only scratched the surface. It really is amazing. I think a lot of people just take their heart for granted until something goes wrong.
It's true. We don't always appreciate how hard it's working for us.
Yeah.
Every second of every day.
Right. And we've talked about some of those things that can go wrong. Heart failure, valve defects. But it's easy to get lost in the, technical stuff. What I'm wondering is, what does all this mean for the person living with it? What does it actually feel like to have heart failure?
That's an important question. And as we touched on before, the experience can vary quite a bit, depending on which side of the heart is most affected.
Right. Left-sided heart failure, fluid backing up into the lungs.
Exactly. And that can cause a lot of respiratory symptoms, shortness of breath, wheezing, persistent cough. Some people even describe it as like a feeling of drowning, like they just can't get enough air.
Wow. That's intense. So basically, in left-sided heart failure, the lungs are the ones that really suffer.
You could say that, yes. And it can make even simple activities really difficult, walking upstairs, carrying groceries, things like that.
And what about right-sided heart failure? What's that like?
Well, with right-sided heart failure, the backup of fluid happens in the rest of the body. So you get swelling, edema in the legs, ankles, feet, sometimes even in the abdomen.
So instead of struggling to breathe, they're dealing with uncomfortable swelling.
Yes. And that swelling can be pretty severe, makes it hard to move around, even to wear certain clothes.
So both types come with their own set of challenges.
They do. And it's not just about the heart itself. It's how that malfunction affects the entire body.
Right. And you mentioned earlier that heart failure is often progressive, meaning it can get worse over time.
That's true, if it's not managed properly.
So what can people do to manage it, to keep it from getting worse?
Well, there are a lot of effective treatments. Medications can help improve the heart's pumping ability, reduce that fluid buildup, control blood pressure and heart rate.
So it's not hopeless.
No, not at all. And lifestyle changes are really important too. A heart-healthy diet, regular exercise, managing stress, all of that can make a big difference.
So it's a combination of medical stuff and healthy habits.
Exactly.
What about those risk factors we talked about? Can people do anything to lower their risk of developing heart failure in the first place?
Definitely. A lot of the risk factors for heart failure are the same as the risk factors for other types of heart disease. Coronary artery disease, stroke.
So it's all connected.
It is. So by addressing those risk factors, you're not just protecting yourself from heart failure, you're protecting yourself from a lot of potential problems.
That's good to know. So as we wrap up this deep dive into the heart, what are the key takeaways? What do you really want people to remember?
I think the most important thing is that knowledge is power. The more you know about your heart, the better you can take care of it.
Absolutely. And early detection is key. If you're having any unusual symptoms, shortness of breath, fatigue, swelling, don't wait. Talk to your doctor.
Exactly. Early intervention can make a huge difference. And even if you have a family history of heart disease or other risk factors, you can still take steps to protect yourself. Live a long and healthy life.
Well, this has been fascinating. I've learned so much.
It's been a pleasure talking about this incredible organ with you.
And to our listeners, we encourage you to keep learning. We've got some great resources in the show notes.
So keep exploring, keep asking questions, and keep listening to your heart, literally and figuratively.
That's a great way to put it. Thanks for joining us on this deep dive. We'll see you next time.